can you tell us what you know about hearing loss in relation to expanders and particularly FME? It's on the Facegenics form about potential hearing loss with expanders, and I'm getting nervous. Is it uncommon? Is it temporary or permanent? Has it happened for FME or just other MARPs? Has it happened with the slow turning protocols, or was it because of turning too fast? Is it full hearing loss or muffling? And just so you know, I have heard this come up a lot in patients. So that one, and then the eye sight stuff. So I know we're not talking about eyesight, but this was had a lot of questions in the question, but know that like a lot of people are asking the same thing.
Yeah. So, with any type of MARP, FME included, I've never had a patient, report or experience hearing loss. And so, um, in fact, well, let's back up a little bit. So there's hearing loss, but then there's also tinnitus, right? And so, like patients experience tinnitus that is related to their jaws and their function, whether they expand or not. So some patients come in, and that's one of their chief concerns. It's like, hey, I have this ringing in my ears, and I didn't used to have it, and something happened to my bite, and then now I have it. And whether it's expansion or whether it's just orthodontics to correct the bite, some forms of tinnitus are caused by inflammation in the jaw joint, which is very close to the ears. And it basically has, some feedback or whatever you want to call it. The inflammation in the jaw joint tends to refer or have this associated symptom of tinnitus. And so in those cases, like when we expand or when we just align the bite or whatever we need to do to get the bite aligned to reduce the inflammation in the jaw joint, then things like tinnitus can go away. Now, as far as it causing hearing loss, so it's on their consent. I mean, I'm sure there's a lot of stuff on the consent, right? Now, how could it cause hearing loss? I mean, I don't know. I mean, obviously, the whole mid face is moving. I would have to, like I say, I haven't seen or superimposed an image that had a patient who had hearing loss. Again, I haven't heard about it personally. Nobody who's done consults with me have reported hearing losses, or the online, consults or superimpositions. So I'm not sure. Certainly when you're moving the facial bones, there are unpredictable things that can happen. The vision, we did an interview on jaw hacks for the vision complication on the last interview that we did, and that seemed to in my opinion, be most related to the amount of turns that were done in a very short amount of time. So basically, the loading of that expander caused a very rapid movement of the orbit, and in general, it seems as though the midface, if it's moved at a slow enough rate, the risk of all of these things goes way down. And so again, that's why I always tell my patients like you should never be pushing it, right? I mean, like if you feel like you're turning too hard, you're probably turning too hard. And you need to spend more time stretching and waiting until those pressures reduce so that you can have the expansion without having to increase the force to levels where, in my opinion, the risk increases.
So it sounds like it's not very common in
Yeah,
what you've seen.
I've never seen or heard of it on any of my own patients or on any of the patients I've consulted with. None of them have reported hearing loss after expansion.
Yeah, and I can say I'm somebody who got vertigo with MSE, and, it was temporary. It happened towards the end of expansion, and then once I put braces on and started moving my molars and everything, it felt like it was a molar kind of issue, especially with the arms of that device. Um, it all went away, but I got, like, worsening tinnitus and then vertigo, but it was temporary, so hopefully
And that makes
that
sense.
holds.
Yeah, so when you expand, I mean, the bite is changing, right? And for a while, the bite is going to be worse than it was to start with. So, when I have patients who experience any sort of bite related issues, it might be, pain in the chewing muscles or whatnot. We tend to put them into what's called an in-mouth bite splint, where we basically provide them pads on their teeth to bite onto instead of having the teeth hitting together, and
Uh-huh.
that can take the stress off of the jaw joint. And, so if they were, let's just say they were to develop tinnitus while we were expanding, you could add a bite splint to stabilize the joint while the expansion process is happening. So yeah, I mean, but hearing loss, I mean, like certainly permanent hearing loss. Yeah, that to me, yeah, I've never seen it, and I wouldn't have a good reason or explanation if that has happened to people, like why you would have permanent hearing loss. I would have to ask somebody that's had it or look at it, like what the mechanism is there. I've never heard of that. So yeah.
Yeah, my best guess would be there was already some initial issue to begin with, and I would say for my vertigo and the tinnitus, I already had, like, a right side TMJ issue, and so it seemed to have
Worse.
exacerbated that while I was
That
expanding.
makes sense.